We now have the COVID-19 vaccines, and we're currently rolling it out to subgroup A3, which includes people with comorbidities, and that includes thyroid disorders. And we know for thyroid disorders, it can range from a simple condition to a stormy, complicated illness. And so we ask, are these vaccines safe for our patients? Magandang araw, Pilipinas. Sa ngalan po ng Alliance of Clinical Endocrinologists Philippines, ako po si Dr. Andres Ebison Jr. Kami po ay nagagalak at malugod po namin kayong tinatanggap sa maikling palatuntunang ito tungkol sa COVID-19 vaccine at sa thyroid. Goiter, bosyo, toxic, non-toxic, cyst, nodule, thyroid cancer, hyperthyroidism, hypothyroidism. These are all thyroid conditions, and it comes in many forms. And thus, we cannot help to ask ourselves, are these vaccines going to be beneficial to our patients, to you, our patients, or it can still harm? Joining me in answering all these queries is the Section Chief of Endocrinology, Diabetes, and Metabolism at the Makati Medical Center, the past president of the Alliance of Clinical Endocrinologists, AACE, then my mentor, Dr. Jimmy Aragon. Good day, Dr. Aragon. Thank you for sparing a bit of your time today for this ACE Alliance of Clinical Endocrinologists information drive on thyroid and COVID-19 vaccine, sir.
Thank you, JR, and good to see you, and hello, everybody.
Yes, sir. Let's get straight to the point with regards to our topic at hand. Should our patients with thyroid disorders, hyperthyroidism, hypothyroidism, thyroid nodules and cysts, thyroid cancers, can they get this COVID-19 vaccine?
Yes, JR. If you have thyroid problem like hyperthyroidism, hypothyroidism, or thyroid cancer, you can have your COVID vaccination. Perhaps if you just found out your hyperthyroidism and you have just started treatment, for example, mga methimazole, PTU, or carbimazole, please talk to your doctor so that you'll be clear with the side effects of these drugs. No? For example, fever or rashes, because this can happen if you take these medications. And then when you take your COVID vaccination, you also expect those side effects, no? Like fever and rashes. So you discuss lang with your doctor. It's not a contraindication, para lang klaro sa inyo kung ano yung kailangan yung i-watch out.
Okay, so very, very important that the patient of ours should be educated as well with regards to the effects of the vaccine, the effects of the disease itself, and the effects of the treatment. Ngayon, Doc, binanggit niyo po yung methimazole kanina. Probably i-expand po natin, are the medications po ba of methimazole, carbimazole, PTU, levothyroxine, ito po yung mga common na binibigay natin sa ating mga pasyente. Do they have interaction sa COVID-19 vaccine?
No. So if you are on these medications, it's okay for you to get the vaccine.
Okay, so basta po na naggamutan na, itong mga gamot na po na ito ay hindi po hadlang para po maka-interact or maka-apekto sa bisa po ng bakuna sa ating mga pasyente.
Yes, wala pong kinalaman yung mga gamot na yan. So go ahead and have your vaccination even if you are taking these medications.
Sir, kasama po sa treatment natin, especially po para sa ating mga pasyente po na meron pong thyroid cancer, ay after the surgery ay pinapa-radioactive iodine po natin sila. Or to our hyperthyroid patients, kapag kinakailangan po, pinibigyan din po natin sila ng radioactive iodine. Sa mga pasyente po natin na babakunahan pa lang, pwede pa po ba silang tumuloy sa radioactive iodine kung sakaling yun po ang susunod na treatment sa kanila?
Yes po. Kung halimbawa, kaka-radioactive iodine nyo pa lang, papayuhan naman kayo ng doktor ninyo kung ilang araw kayo hindi pwedeng makihalubilo sa ibang tao. No? And that includes kahit yung family members ninyo. Pero kung tapos na po yung pag-isolate nyo sa family members o sa ibang tao because of the radioactive iodine, then yes, you can go ahead and have your vaccine.
But what about, sir, is yung vaccine first before the RAI therapy?
Pwede po. Pwede po. Pwede kayong magpa-radioactive iodine kahit kakatapos nyo palang magpabakuna.
Okay. So that's very clear. Dr. Aragon, do we expect side effects for our patients with thyroid disorders or thyroid diseases once they get these vaccines?
JR, there are no specific problem that they should expect, no? So the same precautions, baka magkaroon ng pain on the injection site. They may have fever, they may have body pains. So after you have your injection, don't leave the vaccination area for usually about 30 minutes. So just in case you will have allergy to the vaccination, then you are still in the vicinity. But otherwise, wala po tayong in-expect na kakaibang side effects sa mga vaccine.
So at least it will be safe to say, sir, na this the condition, the thyroid condition, the thyroid dysfunction, meron po ang mga pasyente natin, it does not increase their risk for this untowards mga rare side effects na binabalita ngayon sa TV.
Yes po, hindi sila at risk kumpara sa pangkaraniwang tao or pasyente na walang thyroid problem.
Okay. Dok, ititigil ko po ba ang gamot kapag magbabakuna po ako sa araw ng aking bakuna?
Para sa thyroid, hindi po kailangan itigil ang kahit na anong gamot. So yung mga methimazole, PTU, thyroxine, pwede pong ituloy lahat yan.
Ituloy lang. Alright. Dok, kapag natapos na po ako ng aking bakuna, pwede na bang walang face mask? Pwede na ba tayong walang face shield?
Ituloy pa rin natin ang paglagay ng face mask at saka face shield kahit na bakunahan na tayo dahil ang iniiwasan lang naman nung bakuna ay yung severe COVID pneumonia, no? Pero maaari pa rin tayong magkaroon ng mild infection. So para maiwasan po yun, ipatuloy po natin ang paglagay ng mask para po hindi tayo mahawa at hindi rin tayo makahawa.
Yeah, I definitely agree with you, sir, because it will still take time bago po natin ma-enjoy yung benefit of protection of these COVID-19 vaccines. Hindi ibig sabihin po na na-injectan na tayo, we are invincible enough na para na tayong si Superman na pwedeng lumabas. So
yes.
it will
mag-iingat pa rin tayong lahat, no? So
Okay.
social distancing pa rin, maghugas
Yes, sir.
ng kamay.
Yes,
Ganun
sir.
pa rin po.
Okay. So there you have it, our dear patients, dear audience, Dr. Jimmy Aragon. Maraming salamat, sir.
Maraming salamat, JR.
Thank you, sir, for taking a short stop on your busy schedule to answer the queries of our patients. Maraming salamat, sir. Dear patients, I hope in this short video we were able to answer your common questions with regards to COVID-19 vaccine and your thyroid problem and the thyroid disorders, and somehow allay your fears and give you more confidence to get that COVID-19 shot. So that vaccine, please remember, dear patients, are actually an added layer of protection para po sa inyong sarili, para po sa inyong mga mahal sa buhay, sa inyong pamilya, para sa inyong pong komunidad, at para po sa buong bansa. It is our one step closer to normalcy. So please help us, please help the country in achieving that herd immunity para wala na pong mamamatay mula po sa COVID-19. So dear patients, if you have more questions or some things that you need to clear your mind, kung meron pa pong bumabagabag sa inyo pong kaisipan, nararapat lamang po na puntahan po ninyo ang inyo pong doktor sumangguni at itanong kung ano po ang nararapat na mga hakbang na kailangan pong paghahanda bago po kuhanin ang COVID-19 vaccine. Again, this is Dr. Andres Ebison Jr. and this is another edition of Alliance of Clinical Endocrinologists Philippines Information Drive. Stay safe, everyone. Stay safe, Pilipinas.